Good evening.
Good evening.
Good evening. Call the meeting to order. I'd ask the clerk to announce the meeting and call the roll, please. But first, I want to announce that due to COVID-19, we have individuals attending remotely. Participants joining by phone should mute their phones when not speaking to avoid background noise. And during the meeting, please make sure that you announce yourself by name and title every time you speak so the public that is participating knows who is speaking. This is critical given the number of remote participants and his current guidance from the Kansas Attorney General. Please call the roll.
Thank you, Mayor Alvey. Good evening. You are hereby notified that I have called a special session of the Unified Government of Wyandotte County in Kansas City, Kansas, to be held Thursday, August 12th, 2021 at 5 p.m. via online and in the lobby at 701 North 7th Street, Kansas City, Kansas, for an ARPA budget workshop. Roll call. McKiernan.
Here.
Ramirez.
Here.
Johnson.
Here.
Kane.
Here.
Markley.
Here.
Walters.
Here.
Philbrook.
Here.
Bynum.
Here.
Commissioner Burrows sent an absent memo. Townsend.
Here.
Mayor Alvey.
Here. Thank you. Tonight we have the American Recovery Plan Act budget workshop. I'll turn it over to Mr. Bach.
Thank you, Mayor. Doug Bach, County Administrator. It's good to be back in front of you on this topic, which many people in the community are very interested to learn about and for us to dig into as to various alternatives we have regarding the American Rescue Plan. A couple of weeks we came before you to give you an overview of some of the items we were looking at, the areas where we could expend the money. At that time, we also talked about what we were looking at as we thought would be some of the immediate needs. Ms. VonAchen, our Chief Financial Officer, went through and identified one of the big buckets of areas is lost revenue, and how that worked out and where that would go, or why we would be eligible to put money in for that purpose. Tonight, and Kathleen, you want to go ahead and share your screen for the presentation that we'll be doing this evening? We're going to go back through some of these items, and a couple of weeks ago we sent you a more detailed packet talking about all the immediate needs, so we're going to talk through those items. Again, do the refresher on where we are from the revenue replacement, and then talk about where we are from as far as the community and kind of looking at our next steps. And the key point from this is what we're looking to come forward in the next 2 weeks in our commission meeting on August 26th is that's when we'd be looking for the commission to then approve a resolution which would approve funding that goes into those immediate need categories, as well as the revenue replacement. That still leaves a lot of the money that's still out there that we can go through and utilize for various purposes. If we get to a point tonight, you want to go into that in more detail, we can. As we have the entire time block between now and 7 o'clock, but we'll only go as far as this as we want to. So again, no actionable items tonight. However, the action that we will take from tonight's meeting is we will be advancing the immediate needs to the commission meeting on the 26th, as well as the intent to move forward with revenue replacement, which puts it over into our general fund buckets, which gives us the latitude to be able to spend that during our budget process. With that, I'm going to turn this over to Kathleen VonAchen, our Chief Financial Officer, and let her take us through the presentation. Kathleen.
Good evening. I'm Kathleen VonAchen, the Chief Financial Officer, and I'm joined with by Ashley Hand, who will be handling the presentation towards the end. I'm also joined by Juliann VanLiew, our Director of the Health Department, who will be talking quite a bit during the section where we're talking about the proposals. I'm also joined by about 10 or 15 other department directors and staff that are involved in, that were involved in developing this immediate needs list. So tonight we're going to be talking over, as Doug mentioned, 4 areas. We're going to discuss determining the immediate needs, We're going to review revenue replacement and how it's calculated. And then we're going to confirm the community engagement efforts and define our next steps. And the purpose is to hear comments and final amendments to the immediate needs report we gave you, and confirm and agree to an engagement for an public engagement strategy and calendar, and establish some clear next steps for all stakeholders. I should point out that the immediate needs report is available on our ARPA website. So this is going to take you through the buckets. We received 87 million, 55 million of it is for Kansas City, Kansas funds, 32 million for Wyandotte County. And based on the federal, the federal government directs how these funds are to be spent. A portion of the funds can cover revenue loss revenue that was lost during the pandemic during 20 and 21. The remaining funds are eligible for use based on the ARPA categories defined by the U.S. Treasury. And all the funds can be must be obligated by the end of 2024 and must actually be spent 2 years later at the end of 2026. So the Board of Commissioners' goal here is to use the American Rescue Act funds to enable the community to recover from the pandemic, but while also addressing longstanding disparities in our community in key priority areas. So we have together developed some, fulfilling some priorities that we hope to achieve with these funds. And they're in line with our Board of Commissioners strategic goals. So these priorities, fulfilling these priorities include improving public health and community resilience, addressing the disparities of disproportionately impacted communities, diminish family violence and substance abuse, create more stable and affordable housing and prevent evictions, invest in workforce development, augment broadband and internet access in the underserved areas, invest in critical infrastructure, and encourage small business development. All of these areas are, excuse me, all of these areas are also priorities of the American Rescue Plan. So as I mentioned before, and in a white paper I provided you about a month ago, there are deep disparities in our community. So the poverty in Wyandotte County is defined as living on an annual income of about $26,000 for a household of 4 people. And here is a map that shows where the qualified census districts are within our county. And they're defined by the U.S. Treasury or the U.S. Census Bureau as specific areas where certain funding would be eligible to be directed. I have a frog in my throat. So there's 38 of these census tracts that meet those qualifications that are considered qualified. And of the 24 out of the 38 qualified census tracts have an average poverty rate of 25% or greater. And of the 70 total census tracts in the county, 38 of them are on this map here are qualified. And the total resident population amongst the qualified districts is 54% of the total population in the county. So now I'm going to go through a number of slides that summarize all of the proposals that we have developed when we talked with all the departments and the various community groups that we have deemed as immediate. And by immediate, we mean that we need to get the money out the door in order to continue our fight against COVID. So just to give you a scope, there are 5 categories within the American Rescue Plan. And those categories are here: public health, reduce the negative impact, economic impact, disproportionately impacted communities, some ARPA grant support, and then this category are funds that we're using from our revenue loss category to support online processing and technology investments. And within the immediate needs report, which totals $11.7 million, the funding proposals are detailed here with the percentages. So this 11.7 million is split between the county and the city, with most of it coming from the county allocation, 8.8 million, and the city portion, 2.9. So as I mentioned, there's these various categories, and you're going to see the category that we're talking about up on the right-hand corner here. So right now we're talking about public health, and within public health, there are various subcategories. This one on this sheet is vaccination, testing, and contact tracing. All of the items under this subcategory total $1.77 million, and they include a variety of items, which I'm now going to have Juliann VanLiew talk about.
Thanks, Kathleen. Ashley, can you actually go back a slide just so I can get a little bit of a preface, and well, I've got people's attention so they're not reading that slide. Thank you. Thank you, Commission, for having us back this evening and being willing to hear our needs as a health department, and for all of your support that we've received over the last 18 months. I feel very strongly that we would not have achieved a lot of the success in our COVID response if it wasn't for the County Commission that we have. I also have with me this evening Wesley McCain, who for the last 18 months has been pulled out of his community health supervisor role and run the finances in our COVID operation. And so I may be calling on him a bit this evening to give some detail on some of these items. But I wanted to preface first by giving a general idea of where we are in terms of our COVID funding for our public health response to the COVID-19 crisis. About 4.5 months ago, we had 4.9 million in general fund set aside basically for our COVID response for all of our COVID related activities. We are now sitting with about 900,000 left. So in just over 4 months, we've spent about 4 million. We've spent it strategically, and I think pretty wisely. We've made some really positive decisions, and we are seeing the impacts of those decisions. But we are getting to the point where our funds are running considerably low, and that within the next month or so, we will be pretty zeroed out without these ARPA funds. So I just want to go into this with everyone understanding where we are in terms of our ability to sustain our robust COVID response. I also want to just provide a preface to the wide range and variety of projects that you're going to see proposed this evening. As a health department, we have a response far beyond our clinical and our physical response to the COVID-19 crisis, right? COVID has caused so much pain and suffering in our community, but that's not just limited to the individuals who have experienced COVID or, God forbid, passed away from COVID, or for the many caregivers who have sacrificed this year to take care of their family and friends who have COVID. That suffering and pain extends, of course, to the economic and the social impacts of COVID as well. And as a health department, our responsibility is to create a community where people can achieve health and wellness. And so, of course, that goes beyond those clinical needs, those testing and vaccination needs, to those social needs that people have around stability in housing and the ability to purchase food and to maintain employment. And so, again, you're going to see, even though this is immediate needs, many of them from the health department, you're going to see a very wide and broad variety because there is so much need for us to respond to right now. Lastly, I want to note that, a lot of these projects, almost all of them, I think just a couple of them aside, we are rolling out or have already rolled out and are well underway with community partners. And so I think it's an important thing to note that for all of these projects and every dollar that we are investing into these programs and projects, they are being matched by community partner resources. They're putting up staff time, they're putting up their own grant funds. And so by investing this money, the same way we invested the CARES money, we are leveraging it and actually amplifying these funds by doing it in partnership with community. So our priorities as a health department for these funds this evening are, of course, number one, to battle the COVID disease itself. Number two, to battle the social and economic fallout of COVID with a specific focus on equity. And number three, to leverage these funds to amplify them as much as possible, to do that in partnership with the community so that we have a long response to the COVID fallout for the next several years, and we see Wyandotte County come out of this stronger. So with that, Ashley, next slide, please. This first bucket is very straightforward. I'm going to keep it high level because I don't know that we need to go into too much detail here. We have to continue our robust vaccination efforts, of course. This is at our set site, as well as our many mobile vaccine events that are happening every week in coordination with our sporting venues and our schools and our churches and our community-based organizations. We have to continue our testing. Our testing is actually an area where we will likely need to come back and ask for more funding along with contact tracing. When we put these immediate needs together 6 or 8 weeks ago, the COVID landscape was markedly different than it is today, I'm sorry to say. So we have likely dramatically underestimated how much funding we need for COVID testing and contact tracing. Just to give a sense, in the month of May, we tested about 300 people at our various health department related testing sites. In the first 11 days of August, we tested 2,000. So just to give you a sense of the fact that that requires staff, that requires considerable resources. My contact tracing amount that you have here is for 2 contact tracing staff, which is what we were down to in June and doing perfectly well with. We're now back up to 10 because we are seeing 90, 100 cases of COVID a day. So those 2 buckets, we will likely need a little bit more. The rest of these amounts we have on the screen are fairly stable. We need to continue to contract with KU to have access to both a health officer and a deputy health officer. These are Dr. Greiner and Dr. Corvo, who you know very well, who we rely on very closely for their medical guidance and expertise. Number 6 here is a technical assistance project. This project is built to set us up for reducing the burden of the COVID-19 disease on the health department. We need to get community clinics, primary care providers, our federally qualified health centers. We need our other providers in the community to be doing testing and vaccinations with us. And many of them are, but many of them are not. And so we'll be rolling out a technical assistance program to support them in getting up and running so that they can take on some of that burden of vaccination and testing and support the health department in that way. Number 7 here is an initiative that we put together with Judge Brakovich and municipal courts, which would provide an incentive for folks in the court system to be vaccinated, and also would really help the court's backlog in terms of clearing out cases by providing funds for attorneys to assist them in doing so. So it's a unique initiative in partnership with public health in the court system that we think could be very effective in incentivizing vaccines. Next slide, please. This slide kind of runs the gamut a little bit. It's a little bit varied. The first, do you want to speak to the number 8, Kathleen, that didn't come from the health department before I move on?
Yeah, this request is from the Area Agency on Aging to replace food delivery equipment at the congregate sites in order to continue to mitigate the disease spread. At the moment, the food delivery systems don't have sufficient shields and so to guard against the disease. And I believe that the agency is on the call if you have any questions. The other areas that I wanted to touch upon are over here in changes in facilities that respond to COVID. Now, this is this request isn't very much money because we're just addressing the immediate needs right now. But in the additional needs that we'll talk about later in September, you'll see that this request is quite big because there are a variety of facilities, public facilities, that need HVAC improvements in order to improve the quality of the air in the facilities to mitigate the spread. In this immediate needs, what we're looking for are additional machines to clean the air in the various recreation centers, as well as some equipment that's needed by municipal court in order to reopen down. So that's what those are. And the judge is on if she wants to talk with that. There is another request in the municipal court area later on in the presentation, which we will ask the judge to talk about. But all the others are basically public health department.
Thank you. So to skip back to number 9 and 10 here, number 9, it doesn't do a lot of good to do contact tracing if you're not able to support people in quarantine and isolation. Some folks cannot stay at home and isolate because there simply aren't enough bedrooms because there's too many people in the home. So we provide that support for people who have nowhere else to go to quarantine or isolate. We also provide food and household supply and PPE delivery to households for those folks who are able to stay at home, who can't get to the grocery store, can't get out to buy those cleaning supplies, but with those provided at their doorstep, can appropriately stay at home to isolate and quarantine. It's a really important public health mitigation strategy that has been extremely well received with positive reviews from our community members about how helpful that has been to them in allowing them to adhere to public health guidance. Number 10 here, it doesn't do us a lot of good to set up testing or vaccination sites or events if people don't know about it, right? And so it takes a lot of bandwidth. It takes two full-time staff and access to a third-party agency for us to be able to keep up with just how much we need to communicate on the topic of COVID as things continue to evolve every single week with new things coming down from CDC, new mandates going into place. That all requires really robust communications. 11 and 12 here, I know it's no surprise to anybody on this call. This country, and our county included, is experiencing a mental health and substance abuse crisis right now that has been significantly exacerbated by COVID-19. Wyandotte County had higher rates of mental health issues and substance misuse issues before COVID-19, and those have only been made worse by the isolation people have felt, by the economic situation a lot of folks have found themselves in. And so we already had a woefully underfunded and understaffed mental health and substance abuse kind of response network in our county. We just don't have enough providers. We don't have enough points of interventions for folks on these topics. And so especially right now with everything flaring up again around COVID, it's really important that we're able to provide these services. Simple things like mental health and substance abuse services can really do wonders for people in terms of helping them stabilize, stay in the workplace, maintain their home, and all of those really important functions that they need to stay above board with their family members. Next slide, please. This is also a lot of pretty straightforward stuff, but I'll kind of run through it quickly here. Number 14, we're asking for $1 million just to cover the cost of health department staff and contractors. Unfortunately, public health, we run 2/3 to 70% of our budget off of grants, but many of those grants do not allow us to pull staff and deploy them to the COVID effort and stay on those funding sources. So for example, I cannot pull my WIC dietitians off of WIC and deploy them to the vaccine site unless I change their funding source. And so it's really important that we have flexible funding that we can use to cover the salaries of those staff who otherwise are generally paid from grants doing different activities. That also supports a number of our contracted and temporary positions that are keeping our vaccine and testing and other work going. Number 15 here, we bought a lot of equipment, a lot of PPE, a lot of stuff that we use routinely that will eventually have to be stored somewhere. We've also demobilized 2 mass vaccination sites already, and eventually, not sure exactly when yet, but we will demobilize the Kmart site eventually as well. All of those supplies have to be really carefully maintained in compliance with FEMA regulations, and they need to be stored in a weather-controlled environment. And so we are working on securing and making a climate-controlled facility as we speak to make sure that we are prepared for when we shut down Kmart and need to demobilize our final operations. Number 16 is a mobile clinic unit, and that's an actual mobile clinic unit. So you may have seen these really big looking vans. They're more like a big bus where you actually have a small exam room inside. You have a place to draw up vaccines. You have a place for medical waste, all those sorts of things. It's a clinic on the road, essentially. We've been doing our mobile vaccine clinics out of a couple of vans that we've purchased, which is great. But we have a lot more mobile vaccine work to do on COVID, on influenza, on a number of things. And purchasing an actual mobile clinic unit is not only beneficial right now during COVID, but it's an excellent long-term strategy for public health in terms of us staying engaged and continue to provide public health services in the community far beyond COVID. So this is a really strategic investment and way to use ARPA funds now and later. Number 17 is an ARPA coordinator. It's really difficult to manage an influx of cash that's higher than our general average budget on an annual basis. Wes has been doing a fantastic job, but the simple fact is that we need support in this arena. Our business office in the health department is 1.5 FTEs, and they, over the last year, have managed about $22 million, many millions in grants and contracts, which requires an incredible amount of diligence to ensure that there's a level of accountability, that we're getting those outcomes reported to us, that the money is being spent in accordance with the commission's wishes and with our strategic priorities. And so we need support administratively on that front. Number 18 is around evaluation data and analysis. We need to continue to use all the data that's at our fingertips. We have an informaticist at the health department who is doing her best to keep up, and she maintains our COVID hub and dashboard. There's so much more we can be doing, and we can be using a lot more data that we have at our fingertips for decision making if we had the right tools to do so. And so you see some elements in here about improving the way we can report out of our electronic medical record system, about using a third party to evaluate our COVID response. It's really important that we start to do some of that evaluation and look at how effective we've been on a number of fronts of our COVID response in terms of actually, of course, battling the COVID disease itself, but also about deploying resources and communications and effectively working with our commissioners and all those areas that have impacted how successful we've been able to be or not be on the COVID response front. We also need money to continue to do primary data collection. The vaccine hesitancy and the reason why people are or aren't getting vaccinated has changed dramatically in 7 months. The reason people weren't getting vaccinated in January looks quite different than the reasons today. And so it's important we really keep our finger on the pulse of what people are thinking and feeling and hearing. And the way we can do that is by continually collecting information directly from our own residents to know what's happening. Number 19 provides some funding, some really important backbone funding for Vibrant Health, who's the lead agency of our CHIP healthcare access team. That team has shifted and has done a lot in the last year to keep the CHIP work going, but also to mitigate COVID as well. They have a fantastic new project coming online in the next month or two to provide free non-emergency medical transport to any Wyandotte County resident, which is phenomenal. It will allow folks to get access to primary care, hopefully significantly sooner than they otherwise would, which helps us keep chronic conditions from being exacerbated due to lack of medical care. So there's some really important stuff going on in the CHIP healthcare access team, but that work cannot continue if we can't support the lead agency that is doing really the groundwork of bringing that team together, writing the grants for that non-emergency medical transport project and all those sorts of things. And then lastly on this slide, we put together a community education team specific to COVID vaccines. This team has had some great success. If you've been at a farmer's market or a church or elsewhere lately, you may have seen this team out tabling and talking directly to residents. It's really paramount that the health department has a direct line to residents to hear their issues and their concerns, to answer their questions about the vaccine and anything related to COVID. But that requires paid staff and a team of paid staff to be able to be on the ground out in the community soliciting that information and responding to people's concerns. And so we'd like to maintain that team for the next 2 years to ensure that we have that direct line with the community. Next slide, please. So again, we're moving into the negative economic impact section. I think we have just a couple of items from the health department on this slide. Number one, under direct assistance, we like to work closely with Dot Mobile Grocer to provide 7,500 food boxes directly to households that are experiencing food insecurity. Again, these are folks who are directly impacted by COVID and are either unemployed or have reduced wages or otherwise struggling to get by and have food insecurity. Similar for financial crisis support and hygiene personal care items. These are for folks like our WIC moms who come to us in tears because they don't have diapers for their kiddos, which with their WIC cards they cannot purchase. And so again, we are seeing from our community members that we serve directly just how bad some of these really basic needs are right now. And so even a small amount of money like $50,000 can go a long way in keeping those families afloat. Number two here, the bilingual housing navigator. There's a lot of housing resources available at the state level, various federal programs. those programs are difficult to access. And so this is really an effort, number 2 here, to support our community, especially our Spanish-speaking community, in accessing the resources that are already available. What's happening right now is our residents aren't able to get to them because they're, whether purposefully or not, they're difficult to access. They require significant applications. They require knowing where to go, what documentation to provide. And so a simple thing like providing staffing time for bilingual housing navigators can allow our residents to tap into resources that are on the table, but that we're leaving on the table because they're not able to be accessed right now. Similar with the legal assistance, this is a really interesting one. We've heard from a number of folks in our CHIP partnerships across different areas that what they're hearing from the community members is that they have got to have access to legal assistance. And this is for a number of things. This is for housing and evictions. This is for healthcare issues that they're experiencing. This is for immigration issues. Legal assistance is pricey, and a lot of the folks in our community can't access it. And if they could, we could really save them from larger, longer term expenses by keeping them in their homes, by making sure they have healthcare coverage and those sorts of things. And so again, a simple thing like offering somebody legal assistance can be what keeps their family afloat by keeping them in their home, by keeping them employed, by keeping them safe in our community, essentially. Kathleen, I'm going to throw to you for number 5. Or number 4, excuse me.
Yeah, so number 4 and 5 are similar in the fact that what we're proposing is to, with your permission and direction, to create a process where nonprofit agencies and other type of health agencies can submit applications to the unified government. We're thinking of setting up a website with a form or portal for these agencies to submit their applications, justification, data, and forming a committee potentially with including members of the commission to make decisions on the allocation of those funds. So on the nonprofit realm, we're dedicating $500,000 for that process. And then on the small business assistance, similarly, we're going to be dedicating $250,000 for small businesses that are within looking for assistance that reside within the qualified census tract, and then another $250,000 for other small business support, and so that for a total of $500,000 in that area. And I have asked Catherine Carter to put together a proposal, and she is working on that. But similarly, we would have a application process, and it's similar to the process for allocation that was undertaken during the CARES Act. In addition, we are requesting $150,000 to augment the funding of the UG toolbox, and that assists new businesses in navigating the permit process with the funding to cover upfront equipment and startup costs. The item number 6 is tourism to mitigate COVID. And the guidance allows you to provide funding to assist the hotel industry in mitigating the infection and prevention, and to fund prevention measures. This amount would be also set up as sort of an application process. I've asked Alan Carr from the Convention and Visitors Bureau to provide me some thoughts on how to undertake that application process. And it would be focusing on providing funding to hotels to assist in fixing any kind of HVAC improvements. So that's probably where that money will be going for, but similarly, kind of an application process. I want to skip over to number 8, and that's the other economic support. There is a couple of items in there that I just want to touch upon. It's not a lot of money, but it will greatly help us. We are, Bridget Cobbins and I are working on starting up a new program called Bank On, which addresses persons that are unbanked in the community. And this level of funding would actually pay for the portion that is not covered by another grant process. And so it would assist in helping residents that don't have a bank account to get one and to start growing their own credit history and wealth. And it would greatly help the future of a number of residents who right now aren't taking advantage of that opportunity. In addition, we have, in other economic support, there's also a provision to support the public sector in rehiring and the staff or personnel that were either not hired or let go during the pandemic. And so these two items address the recruitment issues that we're having with a little bit of funding for bonuses for the sheriff department, and then some costs related to sending out recruitment cards and postage. And Juliann might want to talk about the job training assistance.
Sure thing, but I don't know if we'd like to swing to Commissioner Bynum first for a question related to one of the previous discussed items.
Thank you. This is Commissioner Bynum. I am more than willing to hold my question until the end of the slides. If we can just make a note that I have a question on slide 12, item 4. Thanks.
Great, thanks, Commissioner. Lastly, on this slide on number 7, this is again a CHIP-related request to support the Wyandotte Economic Development Council, who has been a phenomenal advocate for a number of public health-related initiatives that impact the ability for our families to maintain employment during COVID and beyond, of course. And so WIDEC is leading a number of initiatives in partnership with dozens of partners who are at that CHIP table. A couple of the notable ones are a number of job training assistance programs that they have underway, a new business ESL program that's obviously geared to help our primary Spanish speakers get into the workplace and successfully obtain and maintain employment. And they're waiting to hear on a large grant for a workplace transportation program, which would be phenomenal for our county. We have a lot of folks from a survey that we conducted from the eastern part of our county, we know that would be interested and eligible for jobs in the western part of our community if they could get there, but they can't. And so there's some really timely needs here to allow them to continue to support some really critical improvements in people's access to employment right now. Next slide, please. I have just a couple on this slide and I'll hand it back to Kathleen. Number 2 there around housing support is again related to our community health improvement plan. This team is working really hard on a number of initiatives, but most timely they're supporting and working closely with Crosslines in a new homeless initiative that the unified government is also a part of and at that table for, one that really again needs that stable backbone funding to ensure that we can keep that work moving forward and allow the staff time for that work to take place. So housing support. And then number 5 on this slide is also from the health department. Last year in 2020, we saw the highest number of youth deaths in Wyandotte County in 10 years. It was nearly double of the number of youth deaths we had in 2019. So we have a youth fatality crisis on our hands right now, unfortunately. And so you'll see a number of initiatives in there from the health department to try to stem this tide, relating to education happening in schools, related to supporting a violence community health worker initiative that we are working on in partnership with KU and the Thrive Youth Violence Reduction Initiative with Dr. Jamila Watson-Thompson, which provides folks who can intervene when other folks enter the hospital, especially youth having been a victim of crime, to ensure that we stop that cycle of perpetuation. We are also leaning on this CHIP team, and you see the support for MOXA there as our lead agency to provide a lot of support for our Youth Fatality Review Board, which has convened a wide network of partners, law enforcement, schools, and others to take a really close look at why and how our youth are dying in our community and offer up points of intervention and recommendations for how we can work to kind of build some of those bridges between silos and really, again, work on this youth violence issue. So a number of issues around violence in our community right now, but especially among our youth. And so that's why we feel like there are multiple strategies we need to be employing at once to work on that particular issue. Kathleen?
Yeah, so under educational assistance, housing support, and healthy childhoods, the first item is educational assistance. And we have one proposal here for $250,000. And it's a new program to provide technical skills education to previously incarcerated offenders. seeking to pursue new business and employment opportunities, or to become our entrepreneurs. And this would be in partnership with the Village Initiative. So as you know, many of our residents were previously incarcerated. They have a great difficulty in getting jobs. And so their best bet is to start their own business. And so this would help them to start on that path. The housing support is to actually, I think Juliann talked about that one, housing support. The Healthy Childhood Environments, that's an initiative put forward by our Parks and Recreation Department. This is an area that the Treasury guidelines for ARPA supports, and it would be in order to address the impact on our children during the pandemic. So this would provide after school and summer camps, recreation centers, space footprint analysis in order to get state certification and bring the centers up to code and standards. Right now, they're not up to, some of them are not up to standards, and we need that $60,000 in order to get that to happen so that we can open up those. I think that there was a couple of items here under community benefit navigators, and that's a very important area because there are a variety of proposals and projects available in other areas of the ARPA funding and from the federal government that are going to be providing assistance in a myriad of areas, and yet our residents, some of which are supported by the Human Services Department and others by the BPU, are not able to get the assistance they need. So, for example, in providing what we're thinking is providing some kind of contract staffing assistance to help residents with navigating through the process to get utility bill assistance. We're still looking. We're talking with BPU about that. We're still working out the program idea, but generally we're thinking a staff person to help in that effort would be helpful. The top one is the crisis respite brought forward by the Human Services Department, and it would be a minimum of 160 units per month of crisis respite support for individuals that right now care for developmental disabled patients. And this would provide some sort of mental health relief for those caretakers. And it would assist roughly 30 people per month at $91,000. I'm going to go ahead and talk about this. This is all mine. So this slide not only talks about the ARPA grant support, but also some online processes and technology investments that we are proposing. As Juliann spoke about earlier, we, managing all these funds is going to take a lot of administrative support and assistance. But what we're asking for here is actually most importantly, the grant discovery and writing consultants, because ARPA, the amount that you're looking at right now is only the direct aid amount that we're receiving directly from the federal government. There's a whole myriad, as I pointed out previously, a whole myriad of other programs that we need to maximize and take advantage of. And we need some help doing that. We need someone to help identify all the opportunities, collect all the data, do outreach with our community, and then write the grants. So we're hoping that with hiring a grant consultant and writing consultant, we'll be able to achieve that. And then there's also, what would also be wonderful is if we had a grant management software system that would not only be helpful in this process, but into the future, and being able to consolidate all the documentation in one place and keep track of all the reporting that takes place after we have the grants awarded. Over here on the technology investment side, we are requesting $1 million in implementation of online processes, and that is split 50-50 between the city and the county. And I would be happy to have our chief knowledge officer talk about that in more detail. if you have any questions, he would be happy to talk about that. The second item is the replacement of the municipal court system software. It would assist in replacing a legacy system that is not expected to be supported any longer. That would cost $929,000. And I bet you the judge would like to talk about that a little bit more. Are you on, Judge?
I am. Thank you. This is Judge Brakovich. I'm Brandy Nichols Brakovich, Administrative Judge with Kansas City, Kansas. So the municipal court software program we have, a couple of things came to light during COVID. One is the e-ticketing was discontinued back in I believe 2014, 2015, all dates are gone. But what that means is we hand enter and key in every single police ticket that is issued. We are up over 40,000 citations a year just with the police. That does not include our parking ticket. So that is a heavy lift for us. We have reached out with our current software provider with e-ticketing coming, and they have let us know they are not interested in working with us to make that e-ticketing work. Body worn camera also, as that came on, like many times, we think about that as the police department, but you know, where all of those body worn camera video footage is going to go right into municipal court. So if we don't have the technology to play that, then it becomes kind of useless. But more importantly, one of the largest ongoing costs for the police department and body worn cameras is going to be the storage. And so our legacy system, again, is not interested in working with us to create some sort of communication channel to let the police department know when we can release that body worn camera footage. So the new system would allow us to, once we know we're done with body worn camera video, automatically notify the police department so that they could go ahead and know that they do not need to store that. Additionally, this software, a lot of people don't think about all the different things, but our software has to be an accounting software. It has to have a bank teller. It has to have an audit. It has to be able to make sure we're doing best practices. Then it must report to accounting in the way that accounting needs it to report. We also connect with the criminal justice databases and are required to be as secure as any criminal justice database. It goes on and on and on what we need to do. The thing that we are excited about, the silver lining in this situation, none of us were looking for a new software program. The silver lining in this particular situation is that Overland Park, Olathe, Lenexa, and Wichita are all live or will be live in the next year with this same software program. So what that means is that you're seeing maybe a little bit more of a price tag than you're thinking. But what that means is I don't think we're going to looking at it, I don't think there's going to be any add-ons, because I think Overland Park and Wichita are the closest to what we do, and their models have everything that we need. So the only thing that I think that we would be interested in adding is, after listening to this presentation, I spoke with Dominic via text, and I think we could actually add a qualified census tract in there, where we could maybe even do reporting through a qualified census tract to kind of continue to build the relationship that I think Juliann and I are excited to build through municipal court. So I know we're not just here on municipal court, but that is kind of the elevator speech. If you have any questions, please make sure and ask. I'm happy to answer, but I know you have a lot of things to get done in the next hour and 12 minutes.
Kathleen, you're muted.
Thank you. So overall, as I mentioned, we on the Kansas City, Kansas side, we're getting $55 million over the 2-year period. And then on the county side, $32 million. Now on 55% is split up by $31 million in revenue loss over the 2-year period. And the remaining is for other ARPA categories, which, right? The revenue loss amount we're going to talk about here in a minute. So this is how what you've just been presented is how it splits up. So of the 31 million, some of the proposals here were coming from revenue loss, 1.4 million. And that leaves $29.6 million left in revenue loss, which is being deposited into the respective funds where the revenue loss was incurred. And it will be part of the 2022 budget that is being presented on August 19th. Under this blue series of figures, so $24 million is what we're talking about on the city side for other ARPA categories. And those categories are basically the non-revenue loss categories, which include public health, disproportionately impacted communities, negative impact, economic impact, and infrastructure. So of that 24 million, 1.5 million is proposed in this immediate needs report, and 22.5 million still remains to be discussed or prioritized. We expect that will take place beginning in September. On the county side, it's very similar, although a great deal more of the funds is being spent on the county side for this immediate needs report. So the county received $32 million of it. Their revenue loss was only $11 million, mainly because the county functions are supported by property tax, and the property tax was not as impacted by the COVID crisis as on the city side. So 11 million in loss, that leaves $21 million left in other ARPA categories. And those other ARPA categories, again, are public health, disproportionately impacted communities, negative economic impact, and infrastructure. So of the 11 million that we recorded as revenue loss, $500,000 is being proposed in this immediate needs report. And specifically, it's the portion on the city side that is supporting the online processes and technology investments that Alan proposed. So that leaves 10.5 million that were deposited amongst all the various county funds in the 2021-2022 budget that is being brought forward to you next Thursday as part of the county administrator's proposed budget. So over here on the blue, $21 million in county funds is now available in these other ARPA categories. And this immediate needs report totals $8.3 million in county functions. And that leaves $12.7 million left for to be discussed to address other county needs during the month of September. So the next steps for immediate needs are we're asking for you to review this report and let us know if you have any questions or suggestions. And now would be the time we're taking notes and writing it down. The community impact or the community input will be an ongoing effort over the next few weeks, and we'll see an upcoming agenda item for those details. And then, so once we finalize what the immediate needs are, we're going to put those into a resolution and ask for your approval of that resolution on the August 6th regular commission meeting. So at this time, I would like to ask for any comments or questions from the commission on this report.
Looks like we should start with Commissioner Bynum.
Sorry about that. I can't get to the right screen.
Oh,
Commissioner Bynum?
thank you very much. I appreciate that. My questions are on slide 12 and 15, just for prep notice. On slide 12, under item 4, and it dovetails into item 1 a little bit. I'm thinking back to our CARES Act Spark Committee days, And I don't know if anyone has that total allocation we made handy to our human services and community nonprofits through that allocation, but it would be helpful to know it as I ask these questions. So in item 1, it looks like we're recommending 200,000 to Dot Mobile Grocer for food. And then in addition, 108 for hygiene person, 108 for direct financial crisis support stipend. You'll have to tell me again what that is. And then in 4, 500,000 to receive applications for assistance to the remaining nonprofits in the community that are doing things for COVID mitigation and relief. And I mean, in my mind, that's 10 grand to 50 agencies, and I just don't think it's nearly enough, especially in comparison to the allocation we made last fall. And back to number 1, are we saying then that none of the 500,000 in applications should be for food because we're covering that in number 1? So that's my slide 12 questions.
Okay, so there was never any intent to necessarily limit food assistance in any way. That's a proposal that specifically deals with what is detailed right here. And I did want to mention that the CARES Act is a little different than ARPA, because the money that we will be providing through this application process to nonprofits has to very specifically meet the needs or the eligible uses specified in the legislation. There's not a lot of wiggle room there. So all of these nonprofits, whoever is awarded the funds, will be treated as subrecipients, and they will have to be reimbursed for costs, and we will have to make sure that they actually meet the eligibility. So during the CARES Act, I think it was a little bit more flexible. So there were checks cut for vague and general needs, but these have to be very specific to the same requirements that we all have to address. So I'm just saying that. Now the $500,000, I don't know how much, I don't remember offhand how much was allocated for this purpose during the CARES Act during the peak of the pandemic. The $500,000 you're seeing here is just a general ballpark number. It's not based on any kind of specific rationale. And should the commission wish to increase it, that would be your call. I'm happy to propose.
Sure.
And
So
I would
you're,
probably
so
add to
you're,
that, Commissioner, if I may. This is Doug Bach. I just
yes,
remember, this is just an immediate to come out of the box with, to put some
That's
money
true.
out there and play in these categories. So as Kathleen said, in the next month, a couple of months, if you determine this is an area we should put $5 million in
mhm,
based on the need and stuff, that's your call to determine that. We were just trying to come out with numbers to be able to provide the opportunity to our community to get some programs or continue a few programs in certain areas.
okay,
In some cases, just for a short period, and assess where we are with those. And
okay, that's,
and sometimes by putting those requests out, you get a feel for what the need is. And it's kind of like you said, if we put it out and we have 50 come back in with great programs, and we can only have $50,000 to do something, then we would come back and say, okay, commissioners, you might want to think about this a little bit more and see which way you go.
so.
Yeah, that's exactly right. I should have mentioned that too. That's just a beginning. And by the way, my staff is ready to get this geared up and ready to go the minute it gets approved. So.
And just to clarify, I'm hearing 2 things. Number 1, that you're open to recommendations from us about the dollar amounts associated with the variety of categories, but secondarily, I heard that you'd like us to ratify something August 26th. So, when we ratify something on August 26th, are you asking us to put dollar amounts with it, or does it remain flexible at that point?
No,
Well-
we'd rather you would nail down the dollar amount and make it, have it come to a consensus decision on the dollar amounts tonight. That's what I would prefer.
My second question on slide 15 goes straight to this topic that I'm bringing you, and that is slide 15 has a star that says, as of August 12, we have had 90 million requests for funding. So could you speak more to that? Where did these requests come from?
So the 90 million in requests include, by the way, it includes the 11 million that you're looking at here tonight. It includes conversations with all the UG department director staff members that had proposals for services. And it includes conversations with nonprofits or other ideas, a myriad of venues. A lot of it is funding to, I got to tell you, a lot of it is funding to address public facility needs, as well as stormwater needs and broadband needs. So, and just a lot of things. So that's how much it is so far. So,
Okay, so it came from everywhere,
everywhere, yes.
including internally. And I don't know, I can leave this and let the next person speak, but Alan House can probably look back and tell us the allocation that our Spark committee made to the nonprofits back in last fall of 20 and give that to us at some point as we keep talking here. Thank you.
Yeah, Commissioner, this is Alan House, Assistant County Administrator. I just shared that with Kathleen as well via email. There looked like 501c3s were about 3.6 million, so just under 10% of the total CARES Act allocation was 501c3s.
Thank you.
Kathleen, I just wanted to put my finger on one thing, because I'm not sure that what Doug said was received, as I understood it, by the commissioner. Commissioner Bynum, I believe what Doug has said before was that what's going to be proposed for adoption on August 26th is the immediate needs that we just went through, which is that about $11 million request that we just went through. What I believe he was talking about within deploying the $500,000 that you had talked about was that if you look on this slide, the funds for both city and county that say 22.5 million and 12.7 million, those are ones which I believe, if I was understanding Doug correctly, would be ones that are eligible for the commission to prioritize at a later date. So if the $500,000, which is deployed immediately, what the learning that could come from that, what he's saying then at a later date over the next month, then you all could look and say, okay, well, maybe we could allot more of this money to meet needs that were unearthed through that $500,000.
Thank you.
Yeah.
That's very helpful.
Okay.
Kathleen and Juliann, if I could ask a question. So I know that you're presenting to us immediate needs. How many of these proposals actually would require ongoing funding past the 1 or 2 years beyond the immediate need, and for them actually to be effective and achieve the outcomes we're looking for?
So I'm going to have Juliann talk about that because she has the majority of them. The areas that I spoke of were all pretty much one time. They're all one time. So.
Sure, great question, Mayor. There are a few of these projects that of course will need to raise funds to keep going, most notably the ones related to our community health improvement plan. And in any given year, when we're not frantically writing for COVID grants, we're writing for CHIP grants. So we generally have a lot more bandwidth to bring in money to sustain that work than we have in the past year. Every grant we wrote this past year was on COVID. But the majority of the other positions, I would say 80 to 90%, and I'm happy after this meeting to go back and take a look, would be built as time limited positions. And so they would provide immediate needs and support. So many of them are social service based. It's built to get boots on the ground, to provide access to, the many resources that are on the table that can be accessed by our residents today. So they won't be set up and built for long-term positions, except for those few community health improvement plan related positions.
Thank you. And so then again, the funding for the grant coordinator and the discovery would be very important in order to help build that capacity to move forward. And
That's right.
so again, the way you conceive of these funds, these immediate needs, are to really plug the gaps, the specific demands, challenges being brought to us by COVID allows us to resolve those. So actually, in a way, stop the bleeding on a lot of things and try to heal some things that have been caused by COVID. But the long-term strategy still is to, we're just trying to get past this really rough spot and then position ourselves in the future after these funds run out.
Correct.
Thank you. Commissioner Ramirez.
Yes, thank you, Mr. Mayor. I have several questions and then a couple comments. Juliann, my first couple questions relate to the mobile care clinic you mentioned. Do we currently have one already?
We do not. In my 3.5 years here, we've never been able to pull that much capital together for something like that. We just haven't been able to write a grant or anything for it. I believe it's part of our long-term solution to what health department services need to look like in the next 5 to 10 years, honestly. But no, we don't have one today. We have a couple of vans that we operate out of.
Okay, so when we have this going up and running, would like communities and churches and organizations be able to request this mobile care clinic to come to them directly for services?
That is our goal, yes. I'd love to be on site at schools doing pediatric immunizations. I'd love to run community-based influenza vaccine clinics. I'd love to do mammography screenings out in the community. There's so many things that we could do to bring care to people if we had a mobile facility like this.
Okay, great. I think that's a great idea, and I think it's especially a good immediate need, since COVID was front and center of everything in our community, but we still have those underlying health issues within our county that exacerbate COVID. And so if we don't take care of that, then it's very important. So I think that's a really good thing that we look into. The next chunk is about questions are about the dot mobile grocer. What type of foods, because some people, some of the community members who are watching may not know that's available. Can you speak on that a little bit? What they provide, what type of foods are included, and how does that work?
Wes may want to chime in here too, but one of the really amazing things about Dot Mobile Grocer and what makes it so important to the future of food security and nutrition in our community is their ability to have a refrigerated truck that can actually hold produce. So we're talking fresh fruits and vegetables that you cannot buy at your local 7-Eleven on the corner. And so that's really the value add of Dot Mobile Grocer specifically. Food pantries do an incredible job. It's generally dry goods, right? It's cans of beans. It's things that have a really long shelf life. What Dot Mobile Grocer has done is take this into another realm of nutrition where it gives people access to actual fruits and vegetables that can really change the way people eat if they have that dropped on their doorstep. Wes, is there anything you would add?
Just that I've been really impressed with the community. They have a community council that several staff from the health department have been on, but a number of people from across different agencies and neighborhoods have been a part of that, informed the choice of foods that are going to be in this. I know they looked at our WIC. I mean, they did things like they looked at all of the things that are purchased through WIC and which things have been the most popular to inform the kind of things that would be on there. And so I know there's been a community involved process. I can check. I'm not sure exactly what's going to be in each of the boxes that they're going to give out, but I can certainly check, Commissioner, with the folks who run it to get info on that. And then if there's any opportunities to tailor that depending on need or desire of different people in the community.
Thank you. And again, that's an amazing thing that we have. And so, being able to provide more funding to that, to provide more food to our community, it's very important. So it's amazing. Thank you for explaining that. So those who are watching who don't know what the Dot Mobile Grocer is, now you have more information about it, and it is out in the community. There was under that same column, Commissioner Bynum asked the question, but I don't, forgive me if it was answered, but I don't remember if it was. What exactly is that human services stipend that is mentioned within that direct assistance category?
Well, I think we should have Phyllis Wallace talk about that. She's on the call.
Hi, Phyllis Wallace, Human Services Department. The stipend, what you don't get is there are more areas to that than just the stipend, but it would help some of our families who have intellectual and developmental disability family members. It would help them kind of jumpstart and get back to some normalcy. There are a lot of them who have let us know that they are experiencing a number of financial difficulty or barriers. So the stipend would be one way to assist them. Along in that category, we would be also utilizing those funds for say mortgage, rent, car repairs, maybe a monthly bus pass, and any additional financial crisis that they may have a need for. So it really is to get our most vulnerable population in a sense of some normalcy to allow them to get back and just jumpstart their whole their life from the last 17 months. So we've all experienced it, and you can imagine that the folks with developmental disability have even more. It has been impacted. So that's where we're at.
Okay, wow. I did not know that. That's amazing that we have that. And it goes to show that we have a lot of these programs, and we need to do a better job of making sure the community knows about it. And now we have the amazing Ashley Hand, who does a very good job of making sure our communications get out, that we can start getting all of these programs that we have out into the community, so that they know what's happening. Because that stipend is an amazing thing that we have. And so if we can have the community know it more, it could be more use, and that maybe later down the years we can provide more funding to it if it's something that is actually needed. All of these are great. These are great. I am very excited and happy that we have these. The few comments that I have, and then I'll pass it on and stop talking. The legal assistance, a great idea. I know that was something that I briefly talked to Chief Counsel Brown about, was, now that the eviction moratorium, well, it was extended, but at the time it was seen that it was going to expire, and I was afraid for our people, and there was going to be a flood of evictions. And so I think it's important that we continue to protect the most vulnerable in our community. So I think that legal assistance is going to go a long way, and I hope that even after COVID, we continue that, because it is a service that is very desperately needed, especially within the areas who have the highest disparities. And then altogether, I am very, very, very happy that we're coming back to CHIP, but we're using CHIP to help fight and mitigate the causes of COVID. And I think that's an amazing thing to bring CHIP into. So I'm very happy that we're doing that. And my last thing, this goes to Emmerich and Angel. Thank you for all you're doing for Parks and Recreation, and especially when it comes to licensing and certification of after school and summer camp programs. I know all that. I know the hard work and the rigorous work it takes. So I thank you very much for all that you do. It's going to be an amazing amenity for our community once we are certified and licensed and have everything up to the standards and codes. And as always, I am here. I would love to help you in any way, shape, or form with that. As you know, Parks and Rec has a special place in my heart. So thank you for all that you do. And as always, Juliann and Health Department, thank you for all that you've done and continue to do. It's amazing. And we have a long journey, but we still see a light at the tunnel. Thank you.
Commissioner Townsend.
Thank you. Good evening, everyone. I approached this a little bit differently. I went through not only the presentation made tonight, but the other one, the immediate needs report itself, because of how it's segregated by type and the detail it had on these particular sections. So I will be referring to questions I had for that report, and somehow I guess the presenters can make that work. If not, I'll follow it up. But I want to start off with where Commissioner Ramirez left off with the negative impact and the household assistance. And this would be page or slide 15 if we were showing the American Rescue Plan Act immediate needs report. That's not what was put up right now, but it's helped me focus. So we were talking about the stipend, the direct financial crisis support stipend, $108,000. Does the stipend vary from circumstance to circumstance, or is there a specific amount that each family would get, and is there a limitation on how much? And where I'm coming from is, as I looked at this report, just generally speaking, I see we have a lot of staffing requests, which may be needed to run these programs, but I am very concerned and want to focus on those people who are in need getting the assistance. So that's the framework in which I'm looking at this. So with this stipend, if you can help me with that.
Yeah, I wanted to just point out that the stipend you're referring to, it's specifically for intellectually and developmentally disabled residents. So that's why it's under the purview of the Department of Human Services. It isn't for the broader public.
Okay, well, again, I'm looking at what would be slide 15 of the actual immediate needs report. That's not what you put up tonight. Maybe that was a different stipend, but this is human services for $108,000.
Yeah, that's exactly right. That's as I mentioned, it's for specifically for the clientele that the Department of Human Services addresses, and it's for intellectually and developmentally disabled individuals.
Kathleen, it's Melissa Bynum.
Right.
I think Commissioner Ramirez and now Commissioner Townsend are referencing item 1 on slide 12, which is different. The one I asked about.
Yeah, the 108,000 is what I was talking about on page 15 of the report. And I think that's what Commissioner, is that what you're referring to?
Commissioner Townsend, is that what you were referring
Yeah,
to?
I'm looking through this. It's on the
Page 15.
15 of the immediate needs report. Well, I'm glad this question was asked because that's something totally different than what I thought it was. So let me ask this question. Do we have any stipend available to members of the community who are just having a hard time for whatever that is? Food insecurity, utilities, transportation. From what bucket that we've talked about tonight would something like that comes if we have one at all? Because I thought that's what this was.
We do not have, this is Juliann with the Health Department. We do not have a bucket for that in the proposal this evening. We did have something similar to that in our CARES funding. And what we did through that, if you recall, is we funneled a decent sum of money to United Way, who then turned around and provided grants to, I believe, 12 organizations in Wyandotte County to facilitate providing those stipends or immediate needs, whether it's car repair or rent, directly to our residents. I have taken the liberty of speaking with Todd Jordan at United Way to see if they would be interested in a similar setup with ARPA, should commission be interested. And he says, yes, they would be very interested. So if there is an interest in providing direct stipends or meeting those immediate needs kind of with a pot of money that can be used for pretty much anything, I would suggest that we use the same methodology and partners that we did last time, because it was rolled out very successfully, and United Way did a great job of assuring that money was held accountable and using organizations in Wyandotte County that are trusted by our residents.
Okay, well, let me ask that question. Thank you for that clarification. And I do remember United Way as being the disperser for those. So this will definitely go on my want to see list, that we have this money, this huge pot of money available to just meet the basic needs of our citizens. I know sometimes we get, it seems, carried away with the personnel, and I know you have to have personnel to execute the plans, but that's the eye with which I'm looking through this. How much of this money is actually going to funnel down to people who need the roof over their head, food, whatever their immediate needs are, lights on with BPU bills unpaid. So I'm glad this question came up, and that's what I'd like to see. The other question I'd want to ask generally, because I could go through these, I know there are other people behind me who want to ask questions. So generally, how were the numbers, how did we come to these numbers for any of these categories in terms of these programs? Let me take one, legal assistance. This would be slide 16 on the other needs, immediate needs report. So we've got $868,000 legal assistance would be $310,000 of that for 2 full-time attorneys from Kansas Legal Services, helping with evictions, landlord disputes, which we need, counseling for dispute resolution. Who are those attorneys going to be employed by?
They'll still be, Judge, feel free to jump in here. They'll still be employed by Kansas Legal Services, but we would be in a contractual agreement with them to provide those services for us. And, you know, I can only speak for health department items, but when we estimated costs, if there was any partner involved or any partner who would receive, you know, a subcontractor award through ARPA funding, we went directly to that partner to ask, what would it cost you to do this? What does a staff time plus benefits cost? What would you need for a small amount of overhead, et cetera? So all these estimates for health department personnel came from the organizations that we would contract with, or if they're going to be health department staff, obviously we know the cost of that salary and benefit.
Okay.
Judge, anything you would add?
Yeah, Commissioner Townsend, this is Brandy Brackovich, Municipal Court Judge. Patrick, I'm doing that for you, so you can tell me if I can stop that. But yes, we reached out to Kansas Legal Services, much like Juliann did. A couple of reasons why Kansas Legal Services, I particularly reached out to them. I am an alum But on top of that, they are used to grant positions. So they know that when the money ends, there's no obligation. They know how to manage that. Their people are already in place for that. Second, there's been many times in municipal court that I wish we could bridge that gap over to Kansas Legal Services, housing court, codes that comes in when somebody's grandma dies, but the aunt gets the house because they're the one that took care of it, but nobody did the probate. So kind of the goal is to, one, we know they have the expertise in the disparately impacted communities. Two, we know they know how to do the poverty work, get the reporting. Three, we know that they are that they know how to end at a grant and there is no guarantee. And four, we're hoping to build at least legal aid. And I think Juliann was, when we talked about it, any dollar that we build now, we're hoping to educate and communicate and build bridges. So maybe it's $1 investment now that we see $1.75 worth of output for.
Judge, thank you for that. One last question with regard to this. So this is, again, staffing only. There's no money built in this in the event that the tenant resident has to come up with some fee or, and I'm talking for their landlord. This is only staff costs, is that right?
Well, that is a health department question, but I'll tell you from a staff with somebody who put this proposal together, this is just the request for the things that we need to get going. Like, for example, municipal court is on an 8 to 10 week cycle. So if you approve our immediate needs funding, I think we have some additional funding that we'll present with the bigger budget. But if you approve our immediate needs funding, if everybody can move the second I need them to move, that means it will hit municipal court and we will see the reopening November 1st or mid-November. So some of your questions, that's a question for Juliann. But again, as somebody who prepared this is the stuff that we need to even start talking about the greater amount of money that's left. This is just what staff needs to open back up and provide the services to our people.
Okay, thank you. And I was particularly talking about the negative economic impact with the 868 for the legal assistance. That's just for staffing for the Kansas legal attorneys that we'll be using, right?
Correct. There's no slush fund, so to speak, tied to that project that would allow for offsetting those fees that those residents would have. At this point, I would fully support adding in funds for that.
Okay. I know there are others who want to speak, so I'm going to hold these other questions. If I don't get a chance to ask them again tonight, I'll send an email. But thank you very much so far for all you're doing and putting this together. Thank you.
Commissioner Philbrook.
So I'm glad I waited till now because I did enjoy some of the other questions. Not so much the answers. So first off, the money that was asked about for the mobile grocer. And so I have no problems with the mobile grocer. I was part of moving them forward in the community when they wanted funding to do this work. Although I will say I have not heard anything about what they've been able to accomplish, okay, since that started years ago. So I'm like, okay. I'm not sure how they managed to get into this conversation so quickly when there were so many other people who wanted to be part of this conversation that we're having tonight. The part about the direct assistance, household assistance. I'm happy that we have people that are in the disability category that we're addressing this for. But the fact that we have not addressed the immediate need, and this is an immediate need because we already have at least 50 families that have hit the bricks just in the last couple of weeks that are homeless, and a lot more on that list. And the money, where is it going to come from? I call that immediate need. And we have over 2,000 kiddos that are in schools in Wyandotte County that do not have homes. And we're trying to help them, and not all of that is being funded. We've got, somebody talked about the eviction moratorium, and that's kind of a wishful thinking because we have people who did not get their lease extended because the folks who got the money through Kira chose not to extend. A lot of them chose not to extend that their lease. Therefore, the moment they got a chance, they evicted them. So there are a ton of people being evicted that, you know, that they jump through the hoops and our community partners help them get money. But they're still getting evicted right and left. So don't be living in a bubble and think that we're not going to have tent city here in Wyandotte County, because we are going to, and it's going to get much worse if we don't address a lot of this stuff up front and help prevent it. I know that Crosslines has a plan in place with other community partners to help prevent this homeless issue. And I understand that we can take some of the additional monies that are sitting there for the future. And I don't have a problem with that, except I know that we as a unified government want to make sure that we are solvent and being able to do business. But I would suggest that maybe we don't put as much funding into things that are not a immediate necessity, like being able to have a place to live, have food, clothing, all that sort of thing. And ignoring that for some of the other issues. I can't tell you how upset I am. I am deeply disappointed in our approach. We say we've had community conversation. I will tell you that the community that I have talked to feel totally left out of this conversation, and that is a bunch of people. And I can write a big long list if you want to hear about it. But the point being is when we have been hearing from the community the last couple of meetings we've had, and they've said, we haven't been invited to conversations. You know, I have not used the comment about good old boy system before, but I'm getting really hacked off. This has totally got me going, and I'm so disappointed in our approach this time. And we throw a lot of nice words out here about we're going to help deal with diversity issues and disparities among folks that are disproportionately impacted. And I don't see it. I do not see it in this. And I am heartbroken with what we are throwing out here. And then you're expecting the commissioners to genuflect over what you've given us. I have a long list of other things I want to talk about, but I will not do it right now because I feel like there's really no point. Thank you.
Commissioner Kane.
Hey, Mayor. You know, I know we have some immediate needs, but is there ARPA money set aside for public safety, police, sheriff, and fire? And when are we going to talk about that?
I think that would be one where if we wanted to do something in those areas, we could talk about that in the future. You know, I don't know that there's any immediate needs to, are you talking about funding up services within there or toward premium pay?
Well, the premium pay, the personal protective equipment, the places that they live in, you know, I think that you should get the staff members and the union folks together for all those three groups and say, what do you guys think you need? And use some of that monies there. You know, they are exposed more than any of our other employees. So I think we need to help them out.
I think that's a good area for us to dig into and figure out. I don't know that we are looking at something that's right on the immediate cups of, you know, we have to have something to go into that category in the next few weeks. But I would agree it's part of that category as it should be considered.
I'm not saying immediate. I just don't want them to be forgotten. A couple of weeks is fine. I just we need to sit down with all three groups, both sides, and say, what do you think you need? And is there enough money to do some of that work?
Okay.
Thank you.
I'd like to respond a little bit to Commissioner Philbrook's comments. Commissioner helped a lot with putting together the budget, at least for the public health department's items. And I agree with you that the budget that we put together does not address all of the immediate needs that the county has right now. A lot of what we put together are immediate needs for the health department, for the COVID response that we have to do. And then there are some human infrastructure components like that we've mentioned with getting housing navigators in place to be able to access additional resources that are outside of what we have in the immediate needs. The CHIP funding to be able to leverage other projects and resources that are available. And I think maybe the one thing that I would mention would be that as a part of the total amount of funding that's available to the commission through ARPA, I think maybe the immediate needs versus the amount of funding available might have, maybe the language has probably set up this, what we're putting in front of you, maybe a little bit for like a misinterpretation, because above this $11 million, there's, you know, more than $30 million, which is available for the commission that remains unprioritized. And we, you know, in coming into this, in preparing the budget request, you know, we did not get the mandate, nor I think did we feel like we had kind of the mandate to be able to speak to that larger budget, which I think itself would, depending on what the commission and how the commission wants to use it, go a lot more towards not just the human infrastructure and the immediate health department response, but some of those items you mentioned, which are, you know, funding a large, you know, there's a lot of different options for the commission. So I guess I just don't, I wanted to communicate that in presenting it. I don't believe in looking at the immediate needs budget that it's comprehensive of all of the immediate needs. It's focused really primarily on the public health department's response, and then a couple of real key sort of leveraging, you know, staff and personnel positions, including navigation assistance, legal assistance. And there's a lot more things, including food assistance, rent assistance, lots of things that our residents are going to be facing and are facing right now. And there are resources available in the local pot that we've been given that we're talking about tonight. And then additionally through other ARPA funds, which is part of what Kathleen has put together in that sort of grant, you know, that grant searching, I suppose, component of the thing. So I don't know if that satisfies or the things you were talking about, but at least I hope that kind of clears up maybe kind of what we're trying to put in that.
Wes, I'd like to talk back to you a little bit directly about that, if you don't mind. And that is that the monies that I have seen reflected in the immediate response category that we're talking about are a drop in the bucket of what we need for the next 2 months to keep people housed, okay, and healthy. And so I really wish that you would have a in-depth conversation with the group that did the CARES Act funding work, because a lot of that is still in place and they already have the together to disperse those funds and have the people that are trained to work in the community. All of those people still exist and are still in the process, okay? So my comment is no, I don't expect you to put in the overall housing yet, okay? But I expect us to actually stop the bleeding, and the amount that we have thrown at this is not gonna stop a lot of bleeding, okay? And so I think looking at that a little bit more directly, we need to really come up with a little bit different funding, more funding put into that for now in the short term, and then deal with the long term in the next round. But we have to deal with the short term now. We can't put it off. That's all, Wes. Thanks.
So we just wanted to point out one thing. So when the CARES Act funding was adopted by Congress, there was no other legislation that was all the money, and it was all allocated, and it had very little limits on it. Now we have another, this is just the amount they gave to local governments to fight the COVID within their community. There is another $250 billion that is outside of this amount, which we can apply for. Much of it is specifically for housing assistance and other areas. There's all this pot of money out there, which we want to go after and maximize, absolutely. So the plan is to try and be strategic to get all of the funding that we can have made available to us. So that's what
I don't agree with you on what you're saying as far as the limitations on what we had, what kind of hoops we had to jump through. I think that Crystal Sprague did an excellent job, and the people she worked with in the community came back with the reports that they were supposed to be, and they were very detailed. And so I don't know that I agree with you on that, okay? Now, you may be right, but from what I understand and the people that had to do it, I am sorry that we don't have Crystal Sprague working with us on this, because she has been around the pike on this kind of work before, and she knows how to put it together. I'm not telling you that you don't know what you're doing as an administrator of finance, okay? I'm saying that we need the community trust in this, and Crystal has that. So I know, Doug, I'm just creating all kinds of problems, but when it comes to taking care of the community and the folks that can't speak up for themselves, I'm gonna be there. And you know, that's just the way that's the way it is. So I'm really asking that you reconsider the amount of money that you're putting at homeless and the diversity folks that are living in extreme poverty that cannot take care of themselves right now. If we do not do this now, what are we telling our community? What are we telling our community? Because look, I live in a nice place. I'm clothed, I have food, but I'm not these other people. And most of us sitting here are all in good shape. So I would please have a consideration for folks who are not in the same place we are, because putting off one day can make the difference between life and death. And that's a reality.
Commissioner, I think one thing we can do, and I think this speaks to your comments, and Commissioner Townsend, we brought this for you several weeks ago to get an idea of different areas we were looking at, then to provide you with the additional detail, and then coming back tonight to talk through areas that we see that I guess that we've been given that we think, boy, this could go for funding now. Your input is just what we're looking for. If we think we need to put a like amount, like we went to Human Services and say, okay, we need to do something right now to help in that immediate area, to put funding toward a United Way type agency that could help administer needs for basic needs assistance to our residents, which would include things like for those for they're homeless. our number that we went in the human service category was $100,000. I don't know that we know the number. We know that the number to work on a homelessness project is going to be in the millions, but we're just talking about some services to try to get us through, the next several weeks and going like that. Maybe that's a number to put there. And if that's where the commission wants to recommend that we build something like that into it, then what we'd bring back on the 26th could certainly do that.
So Doug, can I recommend that you talk with Todd, with United Way, with his partners, like the Cross Lines folks and Avenue of Life, because those three were the ones that did the grunt work to take care of the community, and those are the ones that know the numbers and have an idea of what kind of money we need for at least the next couple of months to keep people out of the streets. Would that be a possibility?
Yes, it certainly is. I mean, I think we have at least one of those members watching the meeting tonight, so we can start to make that additional communication.
Thank you. Because I don't want to try to throw a number at it, Doug, because I don't know. Those people know. This is the kind of work they do. So thank you.
Certainly, and I guess if that's the direction the majority of the commission think that's something we should be adding to this, and we will put it in there and put it up there for your consideration here in 2 weeks.
Commissioner Ramirez.
Thank you, Mr. Mayor. I support some of what Commissioner Philbrook has said. I also believe we should put more into what we have, but I'd like to remind commission and staff that this immediate needs report is not the end all. It's not the cure to our problems. All of these socioeconomic issues are deeply rooted in our community and in our country. All of these issues surpass us as a governing body, surpass us as a staff. This is only a first step to get to where we need to be. And so, yes, I support that we need to be doing more, and I want us to do more. So I do support that, putting more human services and more funding towards that and the homeless into the immediate needs report. I do support that. But I just want to remind that we're not going to fix it here and now with the money that, yes, this is a gift from God that we've been given to all of this money that we can provide to our community. But it's a first step. It's first of many steps. Again, these are deeply rooted issues in our community that won't change unless we have a fundamental change in our society. And it will surpass us as a commission and staff. So I just would want to remind everyone of that. Thank you.
So we have just a few minutes before really to end the meeting so that we can get ready for the next. Doug, would you just again reiterate what the process is moving forward?
So Mayor, what we're going to do is come back and we will we'll move forward with the packages of items that were presented tonight. But I think we will also reach out to a couple of our service agencies and talk to them about providing the funding for basic needs. It can be there for people for potential, I guess, as it comes to for where we're covering for rental assistance, or that for those going into homeless categories that we could provide assistance for now and try to get a number to build into this immediate needs budget. This would be one that would come back to you. I would also note that within the package tonight, we didn't get to it in the presentation, but we did spend quite a bit of time on it in the last presentation, and that just comes to the revenue loss category. I think revenue loss is a pretty easy category to understand. It's equated simply by looking at how much money we lost last year in the city, how much kind of lost in the county. Kathleen talked about that a little bit when we started the meeting tonight. We will also bring that forward to you on the 26th, and that just allows us to use this ARPA funding and put it over into that category. That just moves it into our general fund budgets. It doesn't designate we're going to spend it on anything. However, when you go through and do your budget consideration, you'll see that money in there. And we talked about that when we went into detail in our on threes about anticipated amounts that are coming to that. So those will be the immediate next steps, Mayor. I think the other ones that I would ask the commissioners to look at that's in the PowerPoint that you have, and we'll come back and discuss this in greater detail, but that was the additional ways to get in and engage the community, walking through that process, what additional steps we want to go through to get more community input in it as you start to consider the other eligible categories of funding for ARPA. Again, we're not under a tight timeline to make our additional decisions for ARPA. We felt like we needed to get out there for where we are from the immediate needs. We know we need to get there from what we're doing with our budget and fill some holes on that side of it. But the rest of that revenue is ones we can get additional input on. We can talk to, we'll get additional from our internal departments and just work with everyone in that regard. But we'd like to spend a little bit more time on that piece that we didn't get to with the commission as far as what we're doing for that community interaction piece at a future date, Mayor.
All right, thank you. We have Commissioner Townsend and Commissioner Philbrook. We just have a few minutes. Commissioner Townsend.
Thank you, Commissioner Townsend. Just too quick, a suggestion with regard to places that the administration might go again to reach out and see what the needs are, again, which is basic needs for the community in terms of rent, utilities, that type of thing. I know that the mayor's office has a list of the clergy, and that might be another collection of organizations that might be consulted in terms of needs, the basic needs we were talking about. So that might be another group. The other thing is, past this immediate needs report, with the other money to be allocated and reaching the community, if we are not under an immediate time frame in the next month, are there any plans to have a public meeting just on this issue? Again, to give the community an opportunity to voice preferences for the other ARPA money, not immediate needs. Thank you.
Commissioner Philbrook.
I have the same question around communications and bringing the public in. I'd like to see what that looks like, because sometimes I think we say we're doing stuff and we think we're really doing it, but it's not we're not accomplishing what we're trying to do, and that is getting the public input. And that itself is creating a major problem with our community. And so I really would like our public to send in comments to whomever you would like them to send to, Mayor, and you can tell us that about how they would like to be involved and, in this conversation, how to contact them. Because if we don't get that from them, then, so it needs to be sent to somebody. How about Ash?
Well, I'm going to recommend that we follow the process that the charter lays out, and that this is a representative body. And so I would recommend that people in the community reach out to their commissioner to bring forward what they think ought to be done, and the commissioner's responsibility, the mayor's responsibility, is to bring that forward. We are out of time. We are adjourned. We will reconvene at 7 p.m. for our regular meeting.